Secretary Susan Akumincha is asking medics to abandon their strike and return to the negotiation table. The CS says the government is committed to end the health impasse that has seen paralysis in the health sector. Akumincha, while speaking in Kajiado County yesterday, expressed hope that the settlement would end this week. But as Husna Mohammed now reports, medics remained adamant in their demands yesterday, holding peaceful protests around the city of Nairobi.
34 days are still going. Unhappy medics held peaceful march on the streets of Nairobi, defying Inspector General of Police Japheth Koome, who had outlawed the protest. The doctors maintained their hard stance of not going back to work if the demands are not met by the government.
They are on the streets because there's a swelling disillusionment in the hospitals. That when they go there, their work only is to confirm that a patient has died. And this is happening because there's a big shortage of doctors, there's a big shortage of health workers across the country.
The striking medics accused the government of failing to listen to their demands. They claimed that the government had run away from the negotiating table.
It is not right that you demand for allocation of funds to the counties to build hospitals, to get kickbacks, but you have no regard to the healthcare workers who offer services in those facilities.
Just today, the health CS, Susan Akumincha, was speaking in Kajiado County, asked the striking doctors to return to the table. She said the government was ready to listen to them.
I want to ask of them that the government has extended an olive branch. The government has given them an offer. It is up to them to come to the table and we discuss their counter offer.
Earlier, the Council of Governors Chairperson Anne Waiguru implored upon medics to end their strike, saying the demands are unrealistic and could dent the economy if implemented.
This would have a ripple effect on all civil servants' basic pay and will therefore require additional allocation of resources to county governments to be able to carry out this task.
Meanwhile, unposted medical interns have dismissed what the government is offering them. They say the 70,000 Kenya shillings before tax is too little.
They work more than 100 hours a week and they are not paid, yet the patients pay money for the services. We are also demanding that they are paid, they are remunerated.
Contrary to expectations, today's medics' protest march was peaceful and without incident. The Inspector General of Police Japheth Koome had said the march was illegal, but following his announcement, a section of civil society groups, including Kenya Human Rights Commission, have now sued the Inspector General over his statement terming his declaration illegal and unconstitutional.
April 16th marks day 34 of the doctors' nationwide strike, day 16 of the clinical officers, and day 15th of the medical laboratory officers. As usual, when two elephants fight is the grass that suffers. Kenyans continue to struggle and be deprived of essential services. Husna Mohammed, KTN News, Nairobi.
Right, well, thank you, Husna Mohammed, for that report. And as the doctors go on with their strike, a section of pilot universal health coverage interns for the 2020 are demanding to be absorbed on permanent and pensionable basis as they had been earlier promised. And this morning I'm joined by Kipkoril Laban, who is on my far left. And on my immediate left is Joyfrey Nyamongo, who are public health and underwent the piloted UHC internship program 2020-2021. Now they're going to be talking to us about their plight and why they are demanding to be absorbed on permanent and pensionable terms. Gentlemen, good morning. Thank you so much for sharing, spending time here on KTN.
Yeah.
I'm going to start with you, Kipkoril.
Yes.
When did it all begin, that 4 years down the line, you're now unemployed?
So what happened during 2020, the government had plans to roll out the universal health coverage program. They advertised for these positions. At the same time, they had piloted in 4 counties this program. It was on trial. They were still trying to see its efficiency. So we were taken in for this program. But just shortly after the advert, we had the COVID-19 outbreak, which shifted the focus of UHC program to now the fight for COVID-19. So this UHC intern staff who were taken in for UHC program, they had to be engaged so much in COVID-19 fight. Most of my colleagues, they worked in isolation centers. Most worked in dispensaries because our posting was for level 1, level 2, level 2, level 3, and level 4. So immediately we were posted, the ministry also advertised for another program, another cohort of UHC, which they were given a 3-year contract with better remuneration, and also you've seen the extension, which is 3 years. We were doing the same job, being assigned the same duties. So here, the word interns, they have used as interns. We were not fresh graduates.
Yeah.
In fact, we have people who had stayed more than 10 years. We were taken in as interns. We were working independently without supervision in the most cases when it comes to interns. We worked, after 1 year, our contract ended. And here they saw this cohort 2 and cohort 3, they've been given 3-year contract. So to take you back, during this interview, we all applied. Competitively, we were recruited.
What cluster were you under? Laboratory?
It cut across several cadres. In fact, it was around 21 cadres. 21 cadres. In fact, it's during this posting that Kenyans received services of some cohorts or some cadres which had never been recruited by the government for so long. Like getting a physiotherapist in a level 3 hospital. In fact, for so long, several years, the government had not employed the community oral health officers. So it's in this program that the real service, the real needed service was realized by the community. We worked for 1 year, we exceeded. It means that we exceeded with all the service. Here also, this cohort 2 are the people we worked with in interview.
Before we get to the cohort 2 and what happened after, you've done your service, the internship service, let me get to you, Geoffrey. When you they wanted the UHC interns, what were you doing before that? When were you licensed? And that feeling of now working for the government, what did you drop in order for you to go to that internship?
Grace, to start with, I was licensed in 2016. I qualified in 2014. My license, I got filed in 2016. And since that time, I've been renewing the license up to date. I was working in a very nice place where I was being paid 3 times all the government wanted to pay us. Remember, they paid us 15K for diplomas, 10K for certificate holders.
You're saying that you guys are being paid 10,000 to 50,000 per month?
Per month.
As an intern?
As an intern. Remember, an intern, but we have the experience because the advert said you must have 2 years experience. You must be a person of a license. You satisfy chapter 6 of the Constitution. All these requirements require resources. And we said now, by being employed by the government, I better resign here, go to the government, because I know there's a better
You had
future.
a bigger vision.
Because now, you see, they have told us, you go there, you'll get employed.
Yeah.
Now, here is a case, you are being paid 15K, same job, same state of economy, same place, issued with the personal numbers, up to date, and then you are released back to the community. You can't go back to your initial position. Now we are jobless. Some of us are now watchmen in town, some of us are cleaners in town, some are at home, some have died out of depression. Some are drinking alcohol around you. We have seen our friends who have lost hope.
Kipkori, is it the same for you? Were you employed prior to becoming an UHC intern?
In fact, I was in this city working for an NGO. But when this advert came, it was a sure leeway to getting an employment to government.
Because
government
it was a
employment.
pilot by the government.
Yeah. And also being a government, okay, working for an NGO, it was good. Now that you've been posted, there's that the community dependence on you. You work in the same environment with someone earning, in fact, more than 5 times, because most of us, they were in the same job group. In fact, we were posted with a job group with 15,000. Someone who you are working, doing the same job with, in the same job group, earning almost 5 times what you are getting there.
Okay.
You've left this job you were doing before, a lucrative one. You are now being underpaid. There is pressure from the community. You have personal needs. You have help loans, because most of us, it's not that we schooled using help loans, the government loan. Even right now, those loans are, the interest are so much, we've not paid. Right now, we are defaulters. So that's the mess we got into by just allowing ourselves to go work for the government and serving diligently, passionately during the COVID-19. It's at this time, during this COVID, there was total chaos everywhere. You have to monitor for the government, because even we had to raise surveillance. There's this person who has visited from the city, for those who are working in remote areas, doing disease surveillance, where contact tracing. You've been posted to isolation centers. There was that trauma. Someone comes, dies in isolation centers. It's COVID. You are going home. People know that you've worked in an isolation center. People fear us even to associate with you.
Because they think that you're a carrier.
So the whole process was traumatizing to the interns.
And you're still earning 10,000.
And the same 15,000 or 10,000 was subject to statutory deductions. Even here, I had to sample even the pay slips.
2,000 or 3,000. All right.
Yes.
Now, let me now begin it from here. You have your license. You have a job. A well-paying job. An opportunity with the government comes up. You have to let go of this because you have a vision of working for the government. You now enroll to the UHC with the hope of being employed on permanent and pensionable basis, because that is what you were told is going to come. A year later, in 2021, you are dropped.
We were dropped.
What happened after that?
You know, it reached a point now that we were on a program funded by the national government. It reached a point, there is no more pay. Your services has ended. So some left. There are some who are resilient enough to still volunteer in those hospitals, working without any pay. Until they were that much exhausted, some left.
Did you try, maybe Geoffrey, did you try applying for other government health jobs after you were dropped as an intern? UHC, and then Laban is going to tell us his experience as well.
Yeah, we have tried. Personally, I've tried to apply for a government job. 5 counties. And only 1 county that was shortlisted for interview. But you realize, being having worked for the government, we thought that we could have an upper hand in securing a job. But still, I'm not able to get a job. Because you apply, whoever select is taken.
Also to add on what you have said, you know, whenever you apply for these jobs in the government, then also you've listed in your CV that you've worked for the government. There is an IPRO on why you are out. At the same time, because when it comes to public service, that form, the job employment form, you have to indicate if you've ever worked for the government. You indicate your personal number. So this person will be looking at you like you absconded duty.
What happened?
You were dismissed. Even there's that impression.
Yeah.
And also, we've had a challenge. Because when we've had those who they have gone to forces, the moment you are employed maybe in other government parastatals, what happens is you will have to clear from your employer, which is MOH. The process of clearance is hectic.
Is another one.
Yeah. So even having this personal number right now is disservice to us. Yeah.
Before we began the show, you were telling me about you tried applying for a position, but you're told you are already a member.
Yeah. So when the cohort 2 came for the UHC program, most applied and most qualified. But they were filtered out because they already had a personal number. They were already in this system, the UHC.
But as an intern?
Most counties didn't take them. But the likes of West Pokot, they confirmed all the interns. The likes of Mandera, yeah, they confirmed. So the issue has been, even the county government cannot engage you because you are an employee of the national government. But the national government also seconded you to the county. So you are in between national government and counties. We are lost. And even nobody right now, we feel we are used and dumped because right now, what is happening is nobody even want to mention us. They are talking of the medical interns who are the MOs. They are talking of the 3-year contract because they are still in service. And the greatest disservice they did to us is after our service ended, they also extended the contracts of this 3-year contracted just direct. It was not competitive. Maybe we could have featured in because if it could have been competitive, because the first interview which we qualified, it was competitive. The second, right now, they are in process of also, they want to confirm them to permanent and pensionable. So our worry is, if we were at all, we were working for the same program, why exclude the rest? That's the big question.
I think also the bigger question that anyone could ask is, what are your terms of employment? Like, were you really promised permanent and pensionable terms? And who promised you?
Can I respond? Allow me to respond. Okay, you find that after being seconded to the counties, it was now the counties to take us. So you will find that, for the case of, I've mentioned for West Pokot, they were actively involved and they were taken. So you will find there are a lot of disparities between counties. Then another issue also is when it comes to confirmation, money is being sent from the national government to counties. So health being devolved, most likely we are supposed to be confirmed by the counties. But you see now they are shifting blame to the national government.
So it's not like a blame game?
There is a blame game. In fact, to an extent, nobody wants to associate themselves with us.
If I may add on top of what my colleague is saying, you asked about what was our terms.
Yes.
The national government advertised for these positions, and the county governments, respective county boards, or to do the interviews on behalf of the national government. After the interviews, now our data came to MOH. Now again, the second cohort when they were doing the same thing happened. The county government boards did their interviews. So we are being told by the boards, respective boards. That's why you see almost 99% of the counties in the country never confirm the UHC interns. That you people, you are going to be confirmed. So what you do, you better stay with this 15K rather than 10K for 1 year and leave the government, take the other guys for 3 years. So after 1 year, you will be on PNP. Yeah.
Oh, okay.
That's why we see now, we say it does not work for 1 year. And remember, we were on same job group. I was a public health officer job group, H, earning 15K. Another one working as a PHO, job group H, earning 50K.
It's around
the same job. Yeah. Remember, during those COVID-19, they were saying, at a certain age, no one was going to hospital facilities. For example, 55 years. 58 years or 55 years.
They was to work from home.
Work from home.
So the people who are actively engaged.
The UHC group, regardless of the interns or the UHC 3 years, we were the people involved in these programs. The senior most people, they're working from home. Yeah.
Okay. Now, when Laban says, I'm going to get back to you, Laban, but when Laban says that you guys don't feel you don't feel represented, currently, various health unions are on the street demanding for various, benefits of their people. Do you feel represented?
We don't feel, because when you look at the health unions, they're championing for pre-interns. The UHC 3-year program. But for the UHC interns, who are not subscribed to the monthly V, to the respective unions, the unions don't see much value on us. The UHC 3 years program people, they are subscribing to the respective unions. The pre-interns, they want to get licenses. So again, remember, for us, already we have licenses, you are out of the union. Unless you are employed, now you get the value of the union. Now you see, they have said the doctors have been posted. The clinical officers have been posted. I saw yesterday the public health officers have been posted. So the government is meeting slowly their demands. But where are we? The UHC 3 years are being confirmed. Where are the UHC interns? Yeah. So
Laban, if I understand correct, you say that just because you're not remitting anything to these health unions, they don't really see you as priority as compared to personnel who are remitting something to the unions. That's why you feel less represented in things like the ongoing doctor strike?
In fact, the unions, we need to give credit where it's due. Yeah. There is a union, the KUKO, Association of Public Health Officers. To an extent, these people have tried because of we've been engaging them actively. I've told you we were around 21 cadres. The rest are just silent because they don't feel the impact. So there are some few union they have shown interest in us, and we really appreciate. Okay. Yeah, but the rest,
we still have a long way to go.
Yeah.
All right, we're now going to take a very short commercial break, but when we get back, Laban and Geoffrey are going to be telling us what other avenues have they tried to reach so that they can try and get help. Remember, the interns of the 2020-2021 UHC interns are demanding for pensionable and permanent terms of employment. They have been out of employment for 4 years now since they had that particular internship. We're going on with this conversation after the break. Please stay with us.